A 27 Investigates special presentation.
During my active addiction, I was basically living in my own personal hell.
From those addicted to the people who love them. Tonight, a look at the challenges addiction places on families.
What did I do wrong? How did I fail as a parent?
What are addicts going through?
I didn't want to wake up in the morning. I didn't want to be alive. It was miserable.
A look at how counselors, caseworkers, and the courts work with mothers and fathers to overcome addiction and keep families together.
We want to see them succeed. We want to see them get back with their kids.
Plus, where the children of addicts who can't stick with recovery end up.
The need, we get calls constantly. Do you have someone for a 7-month-old? Do you have someone for a sibling group of 3?
This is a 27 Investigates special presentation. Heroin Crisis. Impact on Families.
Well, good evening, everyone. I'm 27 First News anchor Stan Boney. For the last year or so, WKBN has been committed to dealing with the heroin crisis that has not just affected our area, but the entire state and the entire country. In fact, this is the 3rd time within the last year that we have gathered a group of people together to talk about the heroin crisis. And tonight we are going to focus specifically on family issues. I want to introduce you to the panel that we have arranged here for this first segment of this show. Let me introduce you to the 4 women, 2 on my right and 2 on my left. First of all, we have Leanne Cornion. She is the Director of Children's Initiatives for the Ohio Attorney General's Office. Next to her is Linda Spice. She runs a volunteer organization called Solace of the Valley. She has also dealt with a husband, a son, and a granddaughter, all of whom are addicts. Off to my left, we have Judge Sandra Stabil Harwood. She is the Trumbull County Juvenile Judge, also runs one of the Trumbull County drug programs, actually 2 of the Trumbull County programs. We'll get to that as well. And next to her is Chelsea Moran. She is a recovering mother who has been through the Trumbull County Dependency Court. I think her and Judge Harwood are familiar with each other, and we'll get to that here in just a little bit. We also have a group of counselors gathered here in the station tonight, taking your phone calls for any issues you might want to discuss. We got a phone number that you can call in. We also have First News anchor Dave Sess standing by with those counselors. Let's check in with him right now.
Well, Stan, that phone number is at the bottom of your screen. It's on that thing that's scrolling there. It'll come up every so often. You can write it down. I can give it to you right now. It's 1-866-782-4581. I've been talking to the counselors just about their experiences, and they've been telling me that, well, one of them was here for our first heroin crisis special, and one was here for our second. So they've been here before. They know what to expect. They're here to answer your calls. They're from Breaking Point Recovery Center, First Step Recovery Center. There's also a representative from the Warren Family Mission. They can get you plugged into those treatment centers if you need help battling addiction, but they're also here to listen. Maybe you're a loved one of somebody who is battling addiction. They're also here to help you and to listen to you and to provide resources for you if you're frustrated, if you're mentally depressed or going through some of those situations. So feel free to give them a call about all of those types of situations. Again, 866-782-4581. Well, one thing we've learned with this drug epidemic, it is impacting families and many times breaking them apart. Now, the Mahoning County Juvenile Court has been running a program for years that can help. It's called the Family Dependency Treatment Court, and I found one person who's benefiting from it.
How are the boys? And
Jess Wells is working to stay clean. It's tough. She finished residential treatment in April, but keeps seeing the effects of drug abuse all around her.
And I've lost 1 person a week due to this epidemic, this disease. It's a lot of people to lose.
Jess was addicted for 15 years. She started abusing alcohol at age 11, went to pain pills, weed, and eventually something much stronger.
I didn't want to wake up in the morning. I didn't want to be alive. It was miserable. And now just waking up and getting out of bed's, another little miracle.
And those miracles she shares while going through Family Dependency Treatment Court, trying to regain custody of her 3 children. Children's Services works with a court liaison to monitor a person's progress and success, which includes regular drug testing.
we legitimately care. We want to see you succeed. A lot of times there's programs where people think, like, you're just doing it, it's just your job. But it's not.
I mean, all the reports that I have state that you have been doing everything.
The program requires change from the person, and they need to realize that the court, CSB, and other providers are looking out for their best interests. It's been through many changes as the drug problem has switched from cocaine and marijuana to now heroin. But at the root of it all is working with people like Jess who really want change.
But once they get their foot in the door, it seems like they do see that we're there for them, and they do want to make the change in their life and be reunited with their children.
There's 3 phases, and each lasts about 12 weeks. Jess is in the final phase. Children's Services is ready to back her request to the court for returning custody of her children after seeing everything she's done and how the family has responded.
I'm just very proud of the progress that she's made and the family. They're behind her 100%.
Just knowing that I did what I needed to do to, make the courts happy and in the long run make myself a happier person, it's wonderful.
A success story, and this court regularly has successes. Another 2 people graduated from it recently. There are 15 people in the program right now. At one time, it had 29, which is the most it's ever had. Again, feel free to give our phone bank a call, 1-866-782-4581. Our counselors are here standing by. They want to talk with you. They'll listen to you. They'll provide you the resources you need. Live from the phone bank, Dave Sess, WKBN 27 First News.
Well, we just heard from one mother who is a recovering addict, and now we are going to join another mother that is dealing with a similar type issue. We are joined here by Chelsea Moran. She's a recovering mother who has also been through the Trumbull County Dependency Court, which is run by Judge Harwood. Judge, let me start with you. What is the Trumbull County Dependency Court?
We have 2 specialized dockets in our juvenile court. One is the Trumbull County Family Dependency Court. And what that's about is it's an intensive program when children have been removed from their parents and they have addiction issues, the parents. It's an intensive program that we put the parents through with the goal in the end to reunify them if they successfully recover or in recovery with their family, with their children. It's a very intense program, and as Chelsea will tell you, we are on top of her life every single minute. But there's a lot of support in the program, and she's one of our success stories in being reunited with her son.
Chelsea, what is your story? How old are you? Let's start with that.
I'm 23.
You're 23 right now? Okay.
I started using when I was about 12, maybe 11.
Using?
Marijuana and alcohol.
Started with marijuana and alcohol.
I started using pills when I was about 14 and smoking cigarettes. I quit when I got pregnant with my son.
Which was how old?
I was 16 when I got pregnant, and I was 17 when I had him. And when he was about 4 months old, I started using pain pills, Opana specifically, and then started using heroin about a month afterwards. Kind of used the whole spectrum from heroin to meth to crack, back to heroin. I went to rehab whenever I ended up with a court case. I ended up with 2 felonies. So when I got out, I was sentenced. About 3 weeks later, I had a probation violation and was in jail. I went through NeoCap, and when I got out, Magistrate Rudloff actually heard my custody case. My mom had taken emergency temporary custody while I was in jail, and I told her that I had heard about a drug court that they do, and pretty much volunteered myself for a long road, I guess you could say.
When did the road to recovery begin? You're 23 now. How long have you been in the program?
I guess you could say that it started when I went to NeoCap, because when I was in jail...
Which was when?
I went there May 28th of 2015.
So about 2 years ago, you've been in the program. Now you have your son back?
Yes. I received temporary custody September 12th of last year, and I got full custody January 9th of this year.
I don't want to use the term long road back. Was it a long road?
Yes.
Okay.
It was a very long road. I was actually told that I'm one of the most stubborn people that she had ever met.
You told that by the judge?
Magistrate Rudloff,
okay,
actually.
I got you.
But my mom also is not a very... As much as I love my mother and I appreciate what she did, she bucks the system more than I do. So
moms can do that.
Yeah, it was a really long road with her and a really long road with my son.
Leanne, is this a typical story? You cover the entire state of Ohio.
Yes.
Is this a typical story?
Well, she is kind of an anomaly in the fact that she has achieved recovery and she's regained custody of her son, which is fantastic. But unfortunately, her story is not completely uncommon. In Ohio, about 50% of the children in out-of-home care are there because one of their parents is abusing drugs. And about 28% of our kids in custody right now in Ohio are there because their parents are specifically abusing opioids. So it's a pretty common theme across the state.
Linda, a husband, a son, and a daughter? Is that
Granddaughter.
correct? Granddaughter?
Yes.
All recovering?
Yes, they are. My husband's been in recovery for many years. My son is considered a multi-relapser. He started using probably around 12, 13 years old. He became addicted or started using opioids. My brother-in-law was dying of cancer. We brought him into our house, and I left him on the counter. And so when he was 16, he didn't pass math. So my husband sent him to boarding school for the summer. And we discovered at that point, we could tell he was thrown out of boarding school. He definitely had a drug problem. So we took him to treatment, outpatient. I walked in and I said, this is going to be 4 weeks, right? Because he's got to play football in a month. Yeah. You know, because you don't really understand. My husband was already in recovery. And he was very honest and upfront with me when I met him, but I didn't really understand what recovery was or what the journey was. So my granddaughter, my other son told me in January that he had heard that she was experimenting with heroin. She's 18 years old, honor student, full ride at YSU. Very bright, beautiful. And I just really wanted to drop to my knees. And I thought, okay, we can do this. And I talked to her and said, if you want treatment, I will help you get that. She said, I don't really think I need that. Well, a month later, she was back.
She needed it.
She needed it, and she's doing great. Has her 6-month key, embraces recovery, just turned 19 in August, and is back at YSU, doing very well, and I'm really, really proud of her.
And we talk about recovery. Chelsea, what is recovery? I mean, what do you do when do you explain it?
What a lot of people will tell you is that you go to meetings and you get a sponsor and you work steps, but it's a lot more than that. Recovery is putting yourself first. It's putting yourself first in a way that's not selfish. It's like becoming spiritual, not religious, but spiritual enough to care about what you're doing to yourself. And I mean, once you start working steps, you admit that like you're powerless and you know that you need something else. You need an outlet, which is your higher power, because you can't do it by yourself. And it's having like that support group. It's having people that you can run to no matter what, not necessarily because you want to use, but because you want to act out or you want to do something stupid. Like recovery is so much more than just working steps and getting a sponsor. It's learning how to be yourself after destroying every bit of you that you had.
Chelsea, thanks a lot. Our discussion is about families and the heroin crisis, and when we come back, we're going to talk a little bit about a picture that many people saw about a year ago. It was out of East Liverpool. It shows an entire family in one car, a little boy, his grandmother, I believe it was, and they were passed out in the car. It really started a lot of discussion about the heroin crisis in our area. Also, a live look from our phone banks right now. We do have counselors standing by to take your phone calls. Call the number on your screen if you have questions. There is the number 1-866-782-4581. We'll have those counselors there until 8 o'clock tonight. Our look at the heroin crisis returns right after the break.
"27 Investigates Heroin Crisis" is sponsored by Warren Family Mission.
New Day Recovery is a client-centered inpatient detox facility located in the heart of Boardman. New Day offers recovery programs for drug and alcohol dependency, focused on healing the mind, body, and soul. Activities include unique group therapy, art and music intervention, yoga, and meditation. After detox, the compassionate staff provides continuing care options to ensure clients continue on the road to a sober life. At New Day Recovery, every new day is a chance to change your life.
Addiction is a disease, not a choice. It can consume your life and send it spiraling out of control. At Breaking Point Recovery Center, we understand the devastating toll addiction takes on you and your family's physical, mental, and emotional well-being. Our compassionate staff provides a high-quality drug and alcohol treatment program. We believe in long-term support, including housing, counseling, medical-assisted treatment, and more. Let us help you make life manageable again at Breaking Point Recovery Center.
Without the EpiPen, I don't know if my kids would be here today.
Carrying an EpiPen is a necessity. It is not a choice.
We've gone from paying about $100 for EpiPens to over $600.
And they only hold about $1 worth of medicine.
We don't have a choice but to pay it, and the drug companies know it.
Vote yes on Issue 2, the Drug Price Relief Act.
Those drafty old windows are costing you money.
Call Window World first. It'll be the last call you make.
Only Window World offers you our buy once for life guarantee.
Pay our everyday low price once, and you'll never pay anything again for the life of your windows, including labor.
Visit our showroom or windowworldyoungstown.com for details.
Right now, get 8 premium windows, any size, for just $28.23 installed.
Not only do we stand behind our windows, we stand on them.
WKBN's Caring for Our Community program is about making a difference.
It's just about giving back, cleaning it up.
Awarding scholarships to students and teachers. Keeping kids safe with the Kids Identikit program. Doing our part in the Valley.
All about being part of the community, helping out, making things look better.
WKBN 27 and Window World, caring for our community. You're watching a 27 Investigates special presentation, Heroin Crisis, Impact on Families.
And here in the phone bank, I'm with one of the counselors who is on the other end of the phone talking to you tonight, Danielle Gazzoni from New Day Recovery. What is enabling and what is its impact on this crisis?
Enabling is when a parent or a friend or a loved one kind of helps the addict in this situation, kind of gearing them toward trying to help them by giving them what they want, giving them what they need. Sometimes they'll ask for, money or anything like that, and they'll go ahead and give it, opposed to not really understanding what they might be using that money for. It's really hard for parents and for loved ones to see somebody suffer. So what the enabling kind of has that impact is that you're giving and you're giving and you're giving, but you're not really realizing how much you can be hurting at that time. So it's really important for parents, loved ones to understand their boundaries on how they can actually help the
So someone who may have heard that and said, maybe that's me, what should they do in this situation?
Kind of take a step back, maybe call another loved one who you can kind of talk through that situation. It's like, maybe this is what I'm doing, and kind of voicing that out and being mindful of it, and maybe taking that step back and not maybe giving as much. It's very easy to say and very hard to do when you're seeing a loved one, in that situation.
This is a situation that is impacting families. How big is it? As you're seeing in the recovery centers every day, is it getting bigger? How would you describe it?
Sometimes when a client is in the recovery center, we do primarily detox right now, you're going to have parents calling all the time. You're going to have loved ones calling and want to know what's going on, how they can help and what they can do. And sometimes the best thing that they can do in that situation is take that step back, let them focus on their recovery. When that person is ready and ready to be discharged or step down or whatever, then you can kind of go ahead and help. There's Al-Anon support groups for family members who have a loved one in the addiction or in recovery, and they can go and have that support with other family members who are in that same situation where that loved one is suffering.
Great advice. Thanks for talking with me.
Thank you.
She's Danielle Gazzoni. She's from New Day Recovery. She's on the other end of the phone line, 1-866-782-4581. Give any of our counselors here a call. They're willing to help you tonight, so give them a call. Live from the phone bank, Dave Sess, WKBN 27 First News.
Well, it's been just over a year since the face of a 4-year-old boy became the face of the heroin crisis and how it affects families. By now, we've almost all seen this picture, 2 adults passed out in the front seat from some type of opioid drug. One was the grandmother of the young boy who was left alone and frightened in the back seat. These photos are shared hundreds of thousands of times around the world through social media. This is in East Liverpool, where the police department said the decision to release the photo was basically a cry for help, to draw attention to the problem of drugs like heroin and fentanyl, and it did. The young boy now lives with another relative in South Carolina. The two adults do jail time, but the attention isn't slowing the number of overdoses in East Liverpool or other communities. Chelsea, let's start with you. Did you see that picture when it came out? What was your reaction when you saw it?
Pity, I guess. Sadness.
For the young boy?
No.
For the people in the front seat? For everybody in the car?
Yeah. You get to the point where you don't care. It's not that you don't love your children, but you just don't care enough about yourself. And them being posted all over social media is just, it's kind of a breaking point. Either you're at your bottom or you're not going to make it.
Linda, when your son first went on, you first found out what was going on, you mentioned you wished that there was a program like the one in Trumbull County.
Yes.
There wasn't one? This was 10 years ago?
No, there was not a program. And mind you, he hadn't broken any laws at that point, but at the age of 17, and that's why I speak up publicly, he gave a young man a ride in our car to a home, and the young person broke in, stole 8 handguns. And our son, that was devastating. He lost his education. He lost, I mean, I got hate mail in the, what kind of parents are you? And I wish, because I knew he was on drugs. I knew that. I knew something wasn't right. And their behavior changes. And I wish we would have had somewhere to go. We were very fortunate. We had wonderful counselors. We had his, immediately put him back into treatment because, you know, something's not right here. Why would you do that? But like Chelsea said, it just takes over you. And if you have a little, our son's very quiet, and if you have a little bit of depression that goes along with that, it's hard.
Judge, when you decided to start this program, did you know where to start?
Well, I knew that we could do a specialized docket. And in myself, I thought, if we nip this in the bud when they're just teens, 12, 10, 11, that maybe we can prevent this from going on in their adult lives. And we had nothing like that in Trumbull County. So I wanted to be sure that, you know, part of my goal in seeking this seat was to put together a juvenile drug court. So that's what we did, because so many families just don't know where to turn or where to go. And I'd like to thank this station for doing this, because you're putting out there, people just don't know where to call, what to do, and you're doing a tremendous thing by hosting these series.
Leanne, how many drug courts are there in Ohio? Do you know?
Well, there are a variety of different specialized dockets all across the state. Unfortunately, not every county court has a specialized docket for family drug dependency courts. So they're sort of scattered across the state. But not every county has
There's
one.
not 88 of them.
There's not 88 of them.
60, 70? You don't know. Is there a template? If somebody wants to create one, do they go to the Attorney General's office and say, well, how do we start?
The Ohio Supreme Court is the place to go for counties who are looking to...
Ohio Supreme Court?
Yes.
Oh, I'm surprised by
Yes.
that.
Yes.
That's how we are able to get our specialized docket. There's a whole series of steps that we as a court have
What's a
to take.
specialized docket?
Well, you know, we have our regular docket, but then we have these 2 specialized dockets that have to be approved by the Ohio Supreme Court for us to be able to do this. So, you know, in my court...
Meaning you slide these juveniles into this different category,
right,
and you deal with them in a different way.
Right. Yes, that's exactly right. But we have to be approved by the Supreme Court in order
Each
to do
individual
that.
has to be approved, or the whole program
No, the
has
whole
to be
program.
Okay, I got
yeah.
you.
So we have 2 specialized dockets in my court. We have our dependency court, and then for our juveniles, we have the drug court for juveniles.
I got you. How many kids do you see come through your court with drug issues?
Oh,
Can you quantify it?
I just talked, well, let's just say in our delinquency program, I know that out of the children that we now have on probation, I think there's about 12 of them that we know of that have both parents with dependency issues. In our other court, it's like when we're doing dependency and neglect, our numbers have been astounding.
Right.
Since May of this year through the first week into September, we've had 109 emergency custody issues, and most of those have been because of the parents having dependency issues.
Custody issues, meaning they have, now you need to find
We need to
foster
find
families?
placement for them.
Where they
yes.
need to go.
Fortunately for us, many grandparents are stepping up and other relatives so that we can place them, but there is still a shortage, from what I understand, from our director in foster families. I'm not sure if that's exactly because of this epidemic or if we're just falling off because of licensure or whatever, families aren't renewing to be foster parents. But in our court, you know, many families are stepping up, grandparents especially, to take the children.
Yeah.
But the number of emergency filings that we have doubled.
Right.
Just over the summer.
And that's one of the things we're going to look at in the next segment, and that is the amount of children that need foster families. So coming up, we'll break down the numbers and look what the impact of heroin crisis is on families and foster families. That's coming up right after the break.
"27 Investigates Heroin Crisis" is sponsored by New Day Recovery.
Addiction is a disease, not a choice. It can consume your life and send it spiraling out of control. At Breaking Point Recovery Center, we understand the devastating toll addiction takes on you and your family's physical, mental, and emotional well-being. Our compassionate staff provides a high-quality drug and alcohol treatment program. We believe in long-term support, including housing, counseling, medical-assisted treatment, and more. Let us help you make life manageable again at Breaking Point Recovery Center.
Warren Family Mission is asking you to please help someone battling addiction. Our Rides for Recovery program provides free transportation to detox and various programs in and out of state, and help with tuition costs. 100% of each donation will go directly towards this program. Make your tax-deductible donations at the Warren Family Mission, Todd Avenue in Warren, or on our website, warrenfamilymission.com. Your donation could save someone's life. Thank you.
The Super Lot is back and bigger and better than ever.
That's right, one lot and hundreds of vehicles to choose from.
99% are Sweeney certified and include 2 free oil changes, tire rotation, and a limited bumper-to-bumper warranty.
Sweeney makes it easy to purchase a used vehicle with a dedicated staff and over 20 lenders to get you financed. Start shopping today. Click SweeneyCars.com or stop by Sweeney Chevrolet Buick GMC
on Market Street in Boardman.
Morgan Furniture's showroom is bursting with endless choices. Get half off everything plus an extra 20% off your entire purchase. Up to 3 years no interest, or take an extra discount when you buy with cash. This week only at Morgan Furniture and Mattress in Niles.
Making sure your kids have everything they need for school can be overwhelming. Pens, pencils, markers, notebooks, erasers, the list never ends. But WKBN makes it shorter. Start your morning with major local news that impacts your day. An hour-by-hour forecast so your kids know what to wear. Covering traffic problems so no one's late for class. And closings and alerts when the weather gets bad. Your family's morning checklist. Watch weekdays from 5 to 7 a.m. on First News This Morning. Free WKBN 27 Kids Identikits, Saturday, September 23rd at Dunkin' Donuts in Grove City. Stop by from 10 until 2 to get your Identikit. WKBN, partnered with Dunkin' Donuts, caring for our community. You're watching a 27 Investigates special presentation, Heroin Crisis, Impact on Families.
And live in the phone bank, you can see that number at the bottom of your screen and give our counselors here a call. They're ready to talk to you. You know, we're seeing this drug crisis get bigger every day and even pop up in new ways that we've never seen before. You have parents that are dying and other parents that are going to jail, but the kids are the one who seem to be paying an enormous price. The numbers are high for kids in foster care. 15,000 children in Ohio as of August 5th, according to the Attorney General, who also estimated that half of them are in the system due to an adult's addiction. But there are only 7,200 licensed families to give them a home, and the numbers could get even worse.
as these kids, don't linger in temporary foster care, they don't find a kinship placement, they're going to be available for adoption. So we're thinking, in the next 6 to 9 months, there's going to be a lot more kids available for adoption than we've ever seen.
The ideal situation is to keep children with their own blood relatives, but that's been a challenge with multiple members of a family getting addicted. Ohio is a county custodial state, meaning counties are in charge of a child's welfare. But those agencies are strapped and begin to rely on providers like Northeast Ohio Adoption Services for help.
And we're constantly trying to help as many of these county partners as we can because they're desperate. And they're having to place them out of state and separate siblings, and that goes against the core beliefs of any of us working in child welfare. Kids need to be at least with their siblings if they can't be with mom and dad.
Ohioans need to be 21 and be able to support a child and pay for a shelter in order to adopt. Then they need to take 36 hours of classes, which Northeast Ohio Adoption Services offers 9 times a year. In about 4 to 6 months, they're available to take placement of a child.
Now, there are numerous good kids just waiting to find a home. In fact, if you're interested, the best thing to do is at least check it out and see if you're a good fit. Live from the phone bank, Dave Sess, WKBN 27 First News.
Well, we have some other numbers that we want to show you that has to deal with foster care, opioids, and drugs. Let's start first of all with the state of Ohio, and these are the Ohio children in foster care. 50% because of parental drug abuse and 28% due to parental opioid abuse. These are children in foster care and how they've got there and why they've gotten there. Mahoning County, 29% of the children are removed from homes, are taken because of opioid-related issues. In Trumbull County, the number even higher, 46% of the kids in children's services are there because of the opioid crisis. Now, we have one other person now that has joined us here on the panel. It is Patty Amendalia. She is a caseworker for the Mahoning County Children's Services. The number that I gave, or the number that we gave, 29%, when did you see that number start to rise and get to that number?
We've seen over I would say about the last 3 years, our numbers are increasing.
3 years?
Minimally, yes. When I started here, the crack cocaine epidemic hit. And what we're seeing now with opioids is nothing to compare that with. This is an epidemic. This is an emergency.
Now, you are not a supervisor. You're not in charge. You are on the front lines, literally. You're a caseworker, correct?
Yes.
Give me an example of what you deal with of a child needing placed somewhere.
Well, I can start with the photograph that you showed. What would happen would be when the police respond to a situation like this, they're going to call us. And when we arrive on the scene, we're going to first tend to the child that was in the back seat. We're going to make him feel as comfortable as we can. And then our goal is going to be who can take care of him. Those caregivers were arrested. They're going to jail. Plus they have a bigger problem with their addiction. So immediately we're trying to find a relative for that child. That's number one. That's number one. The first thing we're trying to do, and we want to find an appropriate relative. We don't want to put that child from the dangerous situation that he was in with somebody who is inappropriate just because you don't want them in the system. I want the fear of the system to be broken down, and hopefully we can do that with that segment.
Do you have a list of foster people that they can go with, and do you start at the top and work your way down?
What we do, Stan, is
too simple.
If a crisis like this happens during the day, we have an entire department that's what they do. They license the foster parents. They'll start calling them and seeing who is available. When something like this happens after hours, and after hours is the weekends, a holiday, anytime after 4:30 when our business closes. Right. So what happens then is we have foster parents who are on call for emergencies, and that's where the child would go if and only if there's no family. And neighbors and close friends of family are all in that same crux of family and non-CSB placement.
Leanne, is this a typical situation that you see across Ohio?
Absolutely. In fact, just last month, the Attorney General held a press conference to talk about the desperate need across the state for more foster families. As they mentioned, there are about, as of August 5th, there were 15,052 children in custody, but we only have about 7,200 foster families in our state. So that leaves a lot of kids in non-ideal placements. So we need more people who are willing to accept these kids who have dealt with very extensive trauma, watching their parents abuse drugs and overdose and possibly even die, to come forward and become foster parents. But we also need to equip our child welfare agencies with the tools and technology that they need to identify that really excellent kinship placement to put that child in. So we recently at the AG's office invested $1 million in family search and engagement, as well as foster family recruitment for 10 county agencies across the state.
Linda, your kids were fortunate. Their mother was on the call, right?
Yes, yes. And I do have friends that are raising their grandchildren that have had to go through where they were removed and they were able to. And it is not, you know, for a grandparent to start raising children again, you know, like I always commend them and say, you are saving that child's life.
Are you raising your granddaughter?
No, no,
Okay.
No, my friends are, I have two close friends that are, yes.
Judge, you deal with families as much as you deal with the kids?
Yes, we do,
Yeah.
because, you know, oftentimes it's the whole family that's in our court. My court is domestic relations as well as juvenile. So, and there's a ripple effect to all of this too, because just the other day, we're right now talking about how the children are affected, the small children, with this crisis. But it goes beyond that. For example, in our delinquency docket, we have children who, just because the parents have these addictions, they're not being supervised. They're teenagers, they're out there committing crimes, having charges brought against them, and when we take them in, there's often no one to release them to, because we don't have any capable parents to release them to. So fortunately, we have a wonderful children's services agency that steps in and helps us place those children. We just had one the other night, picked up on a probation violation, and no one to release him to.
Well, we talk about addiction a lot, but one thing we don't talk about is the families and the resources that might be available to them, because it puts a stress on everyone in the family. Coming up, we'll hear from a husband and a wife who have found help in talking to other parents and are in the very same situation. 27 Investigates, a special report on family and heroin addiction continues. And again, there are counselors standing by. If you'd like to ask them a question, call that number, 866-782-4581. We'll be right back.
Your weekends start with WKBN, the latest local news and your forecast, helping you plan your day. Saturday and Sunday, wake up with WKBN 27 First News.
Warren Family Mission is asking you to please help someone battling addiction. Our Rides for Recovery program provides free transportation to detox and various programs in and out of state, and help with tuition costs. 100% of each donation will go directly towards this program. Make your tax-deductible donations at the Warren Family Mission, Todd Avenue in Warren, or on our website, warrenfamilymission.com. Your donation could save someone's life. Thank you.
Addiction is a disease, not a choice. It can consume your life and send it spiraling out of control. At Breaking Point Recovery Center, we understand the devastating toll addiction takes on you and your family's physical, mental, and emotional well-being. Our compassionate staff provides a high-quality drug and alcohol treatment program. We believe in long-term support, including housing, counseling, medical-assisted treatment, and more. Let us help you make life manageable again at Breaking Point Recovery Center.
New Day Recovery is a client-centered inpatient detox facility located in the heart of Boardman. New Day offers recovery programs for drug and alcohol dependency, focused on healing the mind, body, and soul. Activities include unique group therapy, art and music intervention, yoga, and meditation. After detox, the compassionate staff provides continuing care options to ensure clients continue on the road to a sober life. At New Day Recovery, every new day is a chance to change your life.
Without the EpiPen, I don't know if my kids would be here today.
Carrying an EpiPen is a necessity. It is not a choice.
We've gone from paying about $100 for EpiPens to over $600.
And they only hold about $1 worth of medicine.
We don't have a choice but to pay it, and the drug companies know it.
Vote yes on Issue 2, the Drug Price Relief Act.
When severe weather threatens, seconds matter. You can depend on Storm Team 27 to be there first.
We are always tracking, using the latest technology to zoom into the weather at your house.
Paul Wetzel is the Valley's most experienced meteorologist, a trained storm chaser, and 17 years of predicting Valley weather.
Predicting severe weather is my passion, but it's also a responsibility in keeping you safe.
To get severe weather warnings first, turn to WKBN Storm Team 27. You're watching a 27 Investigates special presentation, Heroin Crisis, Impact on Families.
And live in the phone bank, one person who understands that impact on families is Dom Marari from the Warren Family Mission. You've been clean 5 years now.
Yeah, I was a hopeless dope addict addicted to heroin and crack, and now I became a dopeless hope addict addicted to Jesus. But, you know, I seen what I did to my family back then, and I see the effects every single day at the mission, just the family members that are hurting. There's people that want the help for their family, but the family members don't want to help themselves to get the help. And I think, you know, if they take the steps, you know, that we have free, you know, rides for recovery. There's other great organizations in the community, and if you just have the courage and make that phone call, you can overcome the addiction.
And you say this is a problem that has layers to it, and you've been trying to explain that to people.
Yeah. Tonight I've been able to answer some phone calls, and I've been able to give 9 people numbers of resources that will change your life if they pick up and place that call. I've also had some a call that was, you know, just angry and just wanted answers, and I said, listen, I don't have the answer. That's the million-dollar question. I think it's a collaboration of layers. We all have to do our part, from law enforcement to legislation to the recovery community to the support networks. It's all about coming together in unity, and together we can, you know, help people recover.
All right, we appreciate you being one of our phone counselors tonight, Dom. Thanks. Again, 1-866-782-4581. The counselors will be here until the top of the hour, so now's your time to give them that phone call. Back upstairs to Stan.
Well, we have been focusing all evening long on the family issues and how they deal with the heroin crisis. Recently, First News reporter Nadine Grimley found a family and talked to them about how they are dealing with the issue.
For Jan and Rocco Greco, their son Rocco's battle with addiction has been a roller coaster ride.
We've had our ups or downs. We had good times. We had a lot of bad times.
We've lived with the lies and the deception and the lack of trust. And to see him normal, that is a blessing in itself.
Rocco's in recovery now, but that in itself is a journey of its own.
There's no delusion about it being him being clean and sober for the rest of his life. It's a day-to-day process. Today he's doing good. Tomorrow will come and we'll see what happens tomorrow.
It's a path they'd never pictured they'd be on. A model of the law, the elder Rocco spent more than 3 decades as an officer for ODNR, and during this interview in 2006 was park manager at Mosquito Lake. He says his view of addicts has changed a lot since then.
I thought they were scum, really, when I was a officer, but now I'm a 360-degree change. I mean, they're all. These people are good.
But seeking support through meetings of groups like Families Anonymous has helped them learn to heal.
This made us feel better, knowing that we weren't all alone. It helped us to deal with certain aspects of our addiction, setting boundaries for the addicts.
I learned how to help other people. I learned that it is not a disease to be ashamed about.
Now the two often volunteer their time, helping others through the Alliance for Substance Abuse Prevention, and were joined by their son Rocco at the group's Rally for Recovery last weekend.
It'll affect us the rest of our lives.
In Trumbull County, Nadine Grimley, WKBN 27 First News.
Well, Linda, I want to begin with you on this one, because I know family support is kind of what's kept you in getting your children and your husband and your granddaughter into it. Talk a little bit about Solace of the Valley. I know you started that. What does that involve?
Okay, what that involves, April Caraway, our executive director, came to me about 4 years
Trumbull
ago.
County Mental Health Board,
yes,
correct?
and she said, Linda, I was at this place and I think we need to have this. When you're in a Al-Anon, Family Anonymous, Nar-Anon, that's totally anonymous, okay? That when you come into those rooms, it's very private. But we found that we had folks like Jan and Rocco, myself, other parents saying, well, we can't go out in the community. So we created Solace of the Valley so we could go and spread awareness through education.
You don't want to be anonymous.
No, I don't want those walls up. I want to be able to go to your court and talk to your parents. I want to go to the Rotary Club and say, I don't have horns, I'm a mom, and let's talk about this. And it truly is a disease. It is a brain disease. We don't like the behaviors, but like I tell parents, and I tell my son, I will always love you, whether you're in recovery or not. May not like what you do when you're not in recovery, but we have these wonderful, fabulous people, and I think we need to spread, and our group is made up of people in recovery, people that aren't, and just community members that want to make a change.
As a family member, one of the issues I hear a lot was when they deal with Narcan, the recovery drug, getting it to someone over and over and over again. As a mother, and I've heard people say we should only give it to them so many times. Your reaction to that?
They could come to my group on Monday nights at 6 o'clock. It's called Healing Hearts. They could look into the parents' eyes and tell those parents that your child wasn't worthy of enough 6 or 7 times. I have 2. I carry one in my car and one at my house. And bottom line, people are human beings. And that's very upsetting. I mean, I have friends that believe that they should just hit them 3 times or whatever.
Name a number.
And then just be done with it. We're not made human beings.
Does that surprise you when somebody says that to you?
They don't say it too much to me because they know what I'm about. I'm an advocate, and I'm a parent advocate. What I would like to see change the system. If you've been brought back, don't let them back on the street. Try to put them, and I know we have to do policy changes. That comes with government. But why can't we pink slip them like we do with a mental illness? Because they're not in their right mind. Wait 5 days. Put them, they don't have to be any place fancy. And talk to them. Bring in trained counselors. Say, there's treatment available for you. Let them have so to speak, a cooling jets, a consequence.
Leanne, I know I've talked to Mike DeWine a number of times about this issue. I've heard him talk about it. He's big on educating from kindergarten, right? That's
Yes.
one thing he wants.
Yes, absolutely. Unfortunately, we have a generation of children who are growing up thinking that drug use and drug abuse is normal and an everyday part of life. So it's really critical that we educate our kids beginning in kindergarten all the way through 12th grade how to say no to drugs, but also how to have those self-control impulses in their own body so that they can resist it long term. And that's definitely something that the Attorney General is passionate about. And in addition to what you just mentioned, we actually funded $3 million in grants to 40 different law enforcement agencies across the state just last week.
That just happened, didn't it?
That was just last week. 16 up here in Northeast Ohio that would allow law enforcement officers to connect with individuals who had just overdosed and help do a warrant handoff to treatment and connect them to the services that they need to achieve recovery long term.
Patty, I know you work for Children's Services, but it almost should be called Family Services, shouldn't it? Because it's, when there's a child involved, it goes beyond that, doesn't it?
Yes.
Dealing with families is a part of your job every day, not just the kids, right?
Right, and we want our families to succeed. In this epidemic that we're in with this opioid, nobody that you encounter, from Children's Services to law enforcement to Family Dependency Treatment Court at Mahoning County Juvenile Court, to all of the fine people that you have working those phones today, nobody wants the addict or the family to fail. No one wants that. We want to be here talking about the success stories. I don't want to hear these people aren't worth the Narcan. I watched one of my clients flatline. I don't ever want to experience that again. I don't want that family to experience that again. There's a lot of work that all of us as providers do for these families, and it's draining. And we have to bring our A game every time we come and work with our families. We need our clients to understand all they have to do is get through today. If today is too big, then get through this hour. If this hour is too big, you can get through the next 30 minutes. You can do it. Recovery works when you work it. The steps work. Like Chelsea said so eloquently, self-care is not selfishness. Self-care is what we all need to be doing. We need our quiet time. We need our time where we can function and enjoy the moment that we're in, interacting with our kids. Recovery works. You have to get honest. You have to be able to get to a place in your life where you say, I'm not going to manipulate anyone anymore. I'm not going to lie. I'm ready to get help. When you do that, you will embrace it.
All right, we're going to take another look at our counselors that we have right now for you. Again, we've talked about a lot of different issues up here tonight. If you would like to discuss those issues with the counselor, you can give them a call. There's the number in your screen, 1-866-782-4581. We'll be right back.
Enjoy a great meal at a great area restaurant for half off. Sign up for weekly email notifications from myvalleydining.com. There's a new deal every week.
Warren Family Mission is asking you to please help someone battling addiction. Our Rides for Recovery program provides free transportation to detox and various programs in and out of state, and help with tuition costs. 100% of each donation will go directly towards this program. Make your tax-deductible donations at the Warren Family Mission, Todd Avenue in Warren, or on our website, warrenfamilymission.com. Your donation could save someone's life. Thank you.
Addiction is a disease, not a choice. It can consume your life and send it spiraling out of control. At Breaking Point Recovery Center, we understand the devastating toll addiction takes on you and your family's physical, mental, and emotional well-being. Our compassionate staff provides a high-quality drug and alcohol treatment program. We believe in long-term support, including housing, counseling, medical-assisted treatment, and more. Let us help you make life manageable again at Breaking Point Recovery Center.
New Day Recovery is a client-centered inpatient detox facility located in the heart of Boardman. New Day offers recovery programs for drug and alcohol dependency, focused on healing the mind, body, and soul. Activities include unique group therapy, art and music intervention, yoga, and meditation. After detox, the compassionate staff provides continuing care options to ensure clients continue on the road to a sober life. At New Day Recovery, every new day is a chance to change your life.
Michael Weinstein has filed 52 lawsuits against government agencies in 7 states, including Ohio. Now he's pushing Issue 2, which requires Ohio to pay legal bills for Weinstein's gang. Here's the official ballot language. Require the state to pay petitioners reasonable attorney fees and other expenses. Before you trust a man who sued government agencies 52 times, read the ballot language yourself. Go to whatisissue2.com, then vote no on Issue 2.
Cortland Bank proudly brings you Kasasa. What's Kasasa? It's an easy way to earn up to 39 times more interest on your money that just might make you want to dance. ATM refunds, no monthly fees, outstanding local service, and way more interest than those mega banks. What are you waiting for? Switch to free Kasasa checking at Cortland Bank.
You're watching a 27 Investigates special presentation, Heroin Crisis, Impact on Families.
And live in the phone bank one more time, our phone counselors have been here since 5 o'clock taking your phone calls. Remember, you've probably tuned into this special wanting information, wanting to know about resources available to handle any type of situation in this drug epidemic. They've got the answers. You just got to make the phone call. 1-866-782-4581. There's still time for them to talk with you. Give them a call before the top of the hour. Back to you, Stan.
Well, one thing we want to focus a little bit on here are solutions. How can we improve the situation when it comes to the heroin crisis, things like fentanyl and heroin itself? For that, I am going to go to Leanne, and the Attorney General has started a START program. Talk about it. What's the acronym mean, and what does it do?
Absolutely. START stands for Sobriety, Treatment, and Reducing Trauma. It's a 2.5-year pilot where the Attorney General is investing $5 million to bring together child welfare, drug treatment, and the courts to provide intensive case management for families that have drug abuse and child maltreatment, so that we can really wrap around these families, give them the supports that they need to become healthy and independent, and also deliver some really intensive mental health services to the child. They've experienced a significant amount of trauma watching their parents abuse drugs, and they really need some specialized help to overcome that and be successful.
Now, it's not the entire state, correct?
That is
just
correct.
a pilot program, and what counties, what areas are you focusing on?
So we are covering 18 counties in southern Ohio, really looking at some of those counties who have been really hard hit and just lack the financial resources to deal with this massive influx in children coming into their system.
Now, we know about the problem in Mahoning, Trumbull, Columbiana, but I hear it's really bad in the southern part of the state. Is that correct?
It is. Unfortunately, the southern part of Ohio was really kind of the epicenter of the pill mills. So when those pill mills were cut off, it was a very quick transition in that region to heroin. So it's kind of going on its almost second decade of dealing with this opioid epidemic in that region.
Judge, when you hear about something like this, are you encouraged?
I'm very encouraged about the amount of money for the wraparound services, because that's what it takes. It takes a lot of support, and especially the mental health component. And that's something else we're looking at too for our juveniles. We're looking at another specialized docket for mental health services.
Patty, be quick. A solution. What are the solutions?
The solutions are for the addicts out there to understand that there is help. They do not have to fear anybody on this panel. They do not have to fear the courts. They don't have to fear CSB. We will embrace them and we will help them.
Agree, Linda?
I totally agree. Yes. And the key to it is to keep talking about it. You know, take those walls down of addiction loves secrets. Get rid of the secrets, you know? And they are there to help you. I mean, when people call, I said they're there to help. And don't look at them like an enemy.
The numbers keep going up and up and up.
Yes.
At some point, they have to start going the other way, don't they?
I would hope so.
Okay.
And with all the work that we're doing all together, embracing them, supporting them, we're learning so much about addiction, and it's really a disease, and we're all thinking in a different way. And again, I can't thank this station enough for having the phone bank so people know where to call, where to reach out.
Now, I know we got 3 people here that work in government, but it's not just a government thing either. The private people got to help out too, don't they?
Oh, absolutely. One of the things the Attorney General speaks on all the time is how it takes community level efforts. It takes individuals within a community to really rise up and address this based on the needs and strengths of their specific community. It's not something that, you know, the AG's office can do alone. We need help from private individuals.
All right, I want to thank you all for joining us here this evening. We've had a
Thank
wonderful
you.
discussion on families and solutions and things that we can do. And we want to thank you for joining us here for this special 27 Investigate report. Hope we have educated you a little bit and maybe helped you out as well. I'm Stan Boney. Have a nice evening.
"27 Investigates Heroin Crisis" is sponsored by Breaking Point Recovery Center.
Warren Family Mission is asking you to please help someone battling addiction. Our Rides for Recovery program provides free transportation to detox and various programs in and out of state and help with tuition costs. 100% of each donation will go directly towards this program. Make your tax-deductible donations at the Warren Family Mission, Todd Avenue in Warren, or on our website, warrenfamilymission.com. Your donation could save someone's life. Thank you.
New Day Recovery is a client-centered inpatient detox facility located in the heart of Boardman. New Day offers recovery programs for drug and alcohol dependency, focused on healing the mind, body, and soul. Activities include unique group therapy, art and music intervention, yoga, and meditation. After detox, the compassionate staff provides continuing care options to ensure clients continue on the road to a sober life. At New Day Recovery, every new day is a chance to change your life.
Without the EpiPen, I don't know if my kids would be here today.
Carrying an EpiPen is a necessity. It is not a choice.
We've gone from paying about $100 for EpiPens to over $600.
And they only hold about $1 worth of medicine.
We don't have a choice but to pay it, and the drug companies know it.
Vote yes on Issue 2.